So welcome everybody. Let's get started this evening because I know we're all excited to find out about starting our year off with a bang. This is 2015 and 2015 promises to be an excellent year. Somebody was saying anytime a year ends in a 5, it will be absolutely phenomenal. So this is great to know that we're in a 5-year and we're going to start it out on the right foot, not the left, the right. So good evening and welcome. My name's Vicki Malo. I am your host and your speaker for this evening. And as you know, I like to give just a little bit of an introduction to myself. I've been in the professional beauty industry for coming up to actually just right on about 30 years. I started out, I think, with my first class in '85. So 30 years, it's absolutely fantastic. It's exciting to be in this industry. So my background is, and started out as an esthetician. However, it grew from there into other different modalities, including a real specialty and passion for feet. And with that passion for feet also came the passion for education, which is brought me into the job of teaching with NASP and becoming a part of the NASP team. And I celebrated my 10th anniversary, so we're going into the 11th year, and I feel that the 11th year, again, is going to be an absolutely fantastic year as well. So let's move forward. So tonight, we're going to talk a little bit about marketplace reality, but I'm not going to spend a whole lot of time talking about that, but there are some new statistics and new numbers that are out there with the new year, and I'd like to get a little bit into that. I also want to get a little bit into understanding the gray zone and what exactly is the gray zone, where we're at with the gray zone, and what we can do about that gray zone. And then, of course, I want to spend a little bit of time talking about NASP, what NASP is, the education you can take with NASP, but I'm also going to get a little bit deeper than that. I want to talk about some of the specialty treatments and services. I want to talk about some of the NASP branded products. But I'm also going to unveil some very exciting new classes that NASP is going to be offering in 2015 and going forward. So I'm really excited about that. And of course, we're going to get a little bit into the business potential. Because whether you've taken a NASP class or not, whether it's on your agenda to take it, or maybe you've done and gone completely through the program and done your BSc, but now what? Where do we go? So this is some of the things that I want to get into, because you should never, ever stop learning. So getting into marketplace reality, one of the first things that I want to talk about is the trends today and the fact that pedicures are no longer that luxury service. They have definitely become a lifestyle trend. More and more people will push their haircuts off, will do their own nails at home, but they will still go in and get that pedicure. But when we look at, that trend today and where it's going, it certainly hasn't been a fad. We've talked about the medi-pedi and the wellness trend for pedicures for a few years now, but it's becoming more and more vocal. Pick up any spa magazine or look through any nail magazine or go online. What's the key thing today? It's wellness, wellness. Everybody wants wellness. So the cycle is starting to turn where, that fad and the fishbowl pedicures and the seasonal pedicures were the in thing. Even the gel and acrylic surfaces on the toenails, they've actually decreased over the last couple of years. They're not as prevalent anymore. And what we are seeing an increase is that wellness pedicure. People that are, going naked on their toes. Not wearing that polish all the time, wanting a little bit of a healthier alternative, or maybe going with just a little bit of a buff and a shine. So we are seeing this real wellness trend today in, of course, the full beauty industry, but also in that pedicure industry. So again, that trend is continuing on, and that wellness style of pedicure, that CMP pedicure, is becoming stronger. So specialty pedicures, when I was doing this presentation, it was exciting for me because I started looking at some of the statistics compared to 2012, 2013, 2014. Specialty pedicures are just over 1 billion. That's just pedicures. Now, when you look at the complete nail industry, the nail industry is just shy of 9 billion. So the specialty pedicures, well, pedicures alone are creeping up, but even the specialty pedicures are creeping up. And the specialty pedicures is a segment that the wellness pedicures fall into. So this is something that I found very, very interesting because the segment is getting stronger. Pedicures make up 23% of salon services. So when you look at the full modality of services that are done in salons, the hair, the makeup, the nails, the skincare and aesthetics, the massage, 23% of those total salon services is a nice piece. So again, that's an area where we can see that the trend is still continuing on and there's a good growth cycle there. But this kind of, I still struggle with this number here, 33, because that's the average price of a pedicure. And I mean, to some of us, that might seem, yeah, that's good. To others, oh, that might be a little bit high. And to still others, that might be way too low. But right now, in North America, $33 is the average price. So, of course, when you look at the spread of pedicures, you do have high-end pedicures coming in at, $125, $150. I mean, yeah, you hear the occasional thing out there, pedicures, $250, etc. But when you look at high-end pedicures, the norm is around that $115, $125. And then, of course, you look at that low end, well, you can see pedicures anywhere from $15 to $20 depending on where you are and what's going on in the area. Now, that's your average pedicure, your basic pedicure. When you look at your specialty pedicure, the average price of a specialty pedicure is $45. Now, to me, that still does seem to be, just a little bit low, but it is starting to climb up. And what is nice to have seen from 2013 to 2014 is the price has actually increased by almost $1.50 for both the services. So people are putting their prices up. And that's a good thing because that's what's going to, continue to drive our industry. In the pedicure industry, 46 years is approximately the average age of the salon client that is receiving pedicures. So as you can see, it is starting to get into that little bit of a more mature client. I have to be careful how I kind of term that, but 46 years is about the average age. Of course, you've got more and more people that are younger coming in, and of course, more and more of an older clientele coming in as well, or an elderly clientele. 46 and over, though, is and shows the largest increase in customers. In 2014, that was the largest increase. In fact, it increased by 35%. Now, when you look at that type of client, what sort of pedicure are they looking for? Are they looking for just that nice, feel-good and pretty toes? Or are they looking for a little bit more than that? To me, this is the type of client that is starting to look for that real wellness style of pedicure. They're starting to have some problems with their feet. They might be starting to see some structural deformities. They might be seeing some skin disorders, maybe some nail disorders. And they want to have these conditions looked after. So this particular Save client is starting to look for a little bit more in that pedicure service. But again, you don't want to, discount others just because they're not in this age category. There's a place. So now we see a couple of numbers here, and we see the number 9 and we see $420. Well, 9 is the average number of pedicures done per week per technician in North America. Well, now I can understand maybe why, people don't think they can make very much money at pedicures. Because if you're charging $33 for a pedicure and you're doing 9 pedicures a week, your gross yearly income is $15,000. We want to be able to take that and drive it upwards, drive the number of pedicures in a week upwards, and drive that annual, not just annual, that weekly, monthly, annual income upwards, because $420 is the average weekly income per technician. So I just, kind of like to ask you, if you fall into that average, are you happy with that average? Wouldn't you like to see that average driven upwards a little bit? Or for your own personal self, see that going upwards? And, even if you take, 9 pedicures at $45 versus $35, that's just over $20,000. Now, maybe for some people that are part-time in the industry and they do it, to kind of feel good, maybe they're okay with that. But I think the pedicurist, the technician on a whole, wants to strive to get beyond that number. And that's what we're going to talk about a little bit later on in the presentation. And why we want these numbers to change and why we want to, move this industry forward has to do with how today's clients have changed, where clients are coming from today. They're seeking instant gratification. We know that. Our clients are becoming more and more demanding. They want a good, clean service. They'll pay more for products that work. They'll put out a little bit more money, but they want to make sure that they've got a quality service, that it's a safe service. It's from knowledgeable professionals. And of course, our customers have become more selective because, again, with the internet today, everybody is much more informed. I mean, you can pick up your smartphone, and I mean, I've done that. Been there, did it, done it. Sitting around in a restaurant and something comes up. What do? Google it. Anybody can Google it at any given time. So if our customer has an issue with their foot and they're sitting in your pedicure chair and they say to you, oh, what's going on with this or that, and you don't have an answer for them, you know what they're going to do? What they're going to do is they're going to Google it right there while they're in your chair. So you want to have the answers. You want to be a little bit more informed. Well, actually, you want to be a lot more informed than your customers are. Now, the final thing is we have a lot more diabetics, seniors, and immunocompromised coming in to have pedicure services. We have a lot of clients coming in that are type 2 diabetic and they don't even know it. So if they don't know it, how can they answer us if we even ask them if they're diabetic? What about the seniors? Today's 70-year-old is yesterday's 50-year-old. People are living longer, a more active lifestyle. They're wearing nice shoes. They're going on holidays and vacation. They want their feet to look beautiful as well. And then, of course, we have more clients that are coming to us that need services, such as our cancer recipients. I got a phone call today of somebody asking, I need somebody to come in and a family member's going through cancer. I need a family member to come into the hospital and to work on them. So we're seeing a lot more of that today with our customers as well. So are we able to service them? Are we able to give them that good, safe, clean pedicure? Do we know what we need to do? Do we know all the steps to take, the precautions to take? And this leads me into more infections and, from substandard pedicurists or salons, or maybe, people just don't know, or one day they get careless. And this is something that even today, just, it's always in the forefront. And even just in January, I've seen a couple of little mentions here and there about infections that are picked up. And these infections can be anywhere from, the fungal infection of the skin or the toenail. You can see that, we've got some Mycobacterium fortuitum going on. That's a very serious infection. You can see a bacterial infection, from somebody that took off just a little bit too much when they did that pedicure service. So you can see that there's a lot of infections that are still going on out there. And if you look on your screen in the upper right-hand corner, what's on that toenail? There's an infection in the toenail. You can see, that there's a little bit of redness and inflammation, but there's gel on that toenail. This makes it twice as hard for any professional to work with this. If it's infected, of course, they need to go and see a medical professional. But even with the medical professional, this makes it so difficult. So again, we want to take care. We need to take the precautions. Know what we need to do with these clients, how to prevent this. And, again, this last picture that we're looking at, I mean, this is a beautiful, wonderful little old lady that came in to get a pedicure service somewhere. And she ended up getting an infection because when they did the corn removal, they went a little bit too far and they created an opening. The implements were sterile, but what did she do after she left the service? So again, understanding how to work on our clients and how to put on what I call, if you've taken any of my classes, I call it putting on your angel arms so that you're not applying hard pressure and cutting somebody. What are they doing after they leave you? And if you've left them with a micro lesion or any kind of an opening, they're much more prone to getting infections. And if these are the seniors, the diabetics, the immunocompromised, there can be some severe, issues that go on afterwards. And, I threw this one in today because these are two that really came to the forefront with me in 2014. Two people that I know of and that I did a little bit of research came up with infections from a pedicure. Now, the first one, that's not a senior. That's not somebody that's even immunocompromised. But this is somebody that went for a pedicure service. They used a pumice. They went a little bit too far, and she ended up with a bacterial infection. Now, the one on the other side of the screen, you can see, is this particular gentleman. This was one's from Canada, one's from Toronto. The first one was from Toronto, the other one's from the United States. So you see it wherever you go. It doesn't just happen in the U.S. It doesn't just happen in Canada. It happens around the world. But, the other one is from the United States, and this particular gentleman was nicked in a pedicure, and he ended up with several surgeries. And this is what his foot looks like in the course of all of his different treatments. And it frightens me to an extent, because if we know the procedures, if we know what we're supposed to be doing, why is this still happening? Why is this out there? And so this leads me into, talking about, standards for education and ways that technicians can increase their knowledge and their billing revenues by knowing the right information. I mean, I know we hear, okay, get an autoclave, get an autoclave, get an autoclave. That's excellent for sterilizing your implements when they need to be sterilized. But that doesn't stop the nicks and the punctures. So this is a two-way street here. You need to take proper care in sanitizing, disinfection, and sterilization when it comes to your tubs and your surfaces and your surroundings and your tools and your implements. But it also plays a role in how that person is pedicured as well. So that's where we look into, technicians looking at ways to increase their billings and their revenues. But it's also knowing what to do where. So you can get excellent revenue from doing pedicures. I was throwing a lot of numbers around over the last few days, and I think you guys know NASP well enough that we don't just pull these numbers out of the air. We have worked with salons and spas. I've done a lot of these exercises in my own salon and spa, where the pedicure services truly can be over $100,000 a year. Pedicure services, doing that wellness style pedicure, $75 to $85 for that pedicure. Of course, then there's the direct dispensing, the retail products. Because we know if your clients are coming into you and they trust what you're doing and they trust your services, they're going to be purchasing products from you as well. And don't forget about the specialty services. And I think sometimes that's what we forget about. But think about it. If you went to a restaurant and you could only have the main course, and that day you decided maybe you wanted dessert and you couldn't have dessert, wouldn't you be a little bit disappointed? Wouldn't you feel, I'm a little bit unfulfilled here, so I guess I got to go down the road to get my dessert? Make sure your clients aren't going to look elsewhere to get their dessert. Know some specialty services. Add those specialty services in. This is what's going to help keep you unique from everybody else that's out there. And we're going to talk in a little bit, we are actually going to talk about some of these specialty services. Because these specialty services, if you're not doing them, they're missed opportunities for you. So this is an excellent way of increasing your revenue stream, is through these specialty services and, of course, direct dispensing. Because if you're not retailing, people will buy foot products somewhere else. Now, of course, we talked about, the trend today, the wellness trend and the billion-dollar industry and how our clients have changed. And, we gasped at some of the pictures and things we saw from infections picked up from some substandard places. And we all know that we would like to get a raise every now and again. And how are we going to do that? We can't just keep putting our prices up, putting our prices up, putting our prices up, and not offer our clients a little bit more. So I think what we need is a standardized education for the pedicurist. Making sure that all pedicurists out there know the basic microbiology, know the threats and what their clients can pick up if they're not careful. Every single person out there in the beauty industry needs to know infection control protocols. They need to know about the different levels of disinfection. And, and I tell this little horrific story every now and again, because back in the day when I went to school 30 years ago, we didn't have 3 levels of disinfection. We had sanitation, we had disinfection, we had sterilization. We actually used to, at one time, strain wax and reuse it. How about everybody back in the day would dip their hands and their feet into the same pedicure pot? Today we cringe at that. But 30 years ago, I don't recall a lot of my clients, or any of my clients actually, getting any kind of an infection or anything. What has happened is the world has changed. We've got superbugs that we never used to have before. And again, we've got clients coming to us, immunocompromised, diabetic, seniors, that we never used to have before. So this is why the protocols need to change. They need to be updated. We need to go above and beyond to make sure that we are compliant. And again, it's just, we know we need to clean and disinfect, sterilize our tools and implements. But what about our foot baths? What about our surfaces around us? It goes beyond that. And then, of course, the effects of biofilms and foot baths. Got recirculating tubs? Then you better know about biofilms. And then we get into the skin and the skin physiology, of the feet, because the feet's different. The skin on the bottom of the feet are very different than anywhere else on the body. And we need to understand that. We need to understand how that skin functions so that we can better work with that skin. Recognize what's going on with that skin, the different skin and nail conditions that are going on out there. Is this a little bit of a lifted toenail, or is it onychomycosis, or is it a wooded nail? What's going on? We need to be able to recognize that so we can make the appropriate recommendations to our clients. We also need to understand the causes of recurrent skin and foot problems. We need to understand the difference between normal dry skin and dry skin that's a tinea pedis. Because if we don't, we could be cross-contaminating all of our clients. We don't know. So this is where you need to have that education. You need to be able to understand the difference so you can pass that along to your clients and your customers. Have you ever had that client that comes in and says, I always get a callus on the lateral aspect of my great toe. Well, she'd say the outside of her big toe. I always get this callus there, and every time I come in, you take it down, and it's all good. It's all good for a couple of, maybe a week, and this all starts coming back. Why does it keep coming back? Can you answer that question? Can you give her recommendations to help keep that callus from coming back? These are the types of issues that we want to be able to address with our clients. Now, another biggie is changes on the foot and leg due to diabetes, CVI, chronic venous insufficiency, and the implications on what we do in that pedicure. We need to know and we need to understand that, because if we don't, again, we could create some harm. We could cause harm to that person. And then, of course, you also need to know which pediceutical to dispense for home maintenance, because I strongly believe in home maintenance. And it goes back to, the stylist. You go and you get your hair cut and colored. You go home. Do you wash it in between? Of course you do. Your clients need to practice that home care in between their visits too, just like they do with their hair. And finally, what's really important is also understanding and practicing the 3 R's. Recognize, recommend, refer. So recognize what's going on, recommend the correct action, and of course know when to refer, know when to touch and when not to touch. And that leads me into the gray zone. Because what exactly is that gray zone? Well, that gray zone is that area that kind of falls in between, kind of cosmetic and medical. It's not really a medical condition, but it's not your typical foot that you might always see. Clients don't feel that it's serious to warrant medical attention or seeing a doctor. Our clients become, they trust us. They trust our judgment. So they ask us more questions than, maybe running off to the doctor. Doctors sometimes, they're busy. They need to look after more important things than maybe a little bit of rough skin on the foot. So, sometimes they look at these skin changes and they don't warrant medical attention. So where does this person go? What happens here? So as a CMP and in doing that CMP pedicure, this helps to address the issues that are in this gray zone. It lets the technician be proactive, not reactive, because we know that foot that we see on the left-hand side of the screen is left. What could happen? It could get worse. That little superficial crack or that fissure we see could get bigger. It could open up. It could bleed. It could get infected. And then it's a reactive issue. So we want to be proactive with our customers and clients. We want to be able to help them out. So in that gray zone as well, and I just threw a couple of other things in, traumatized epidermis. If our epidermis is traumatized, it leads to more than just dry skin. It leads to a portal of entry where we can pick up fungus, bacteria, virus. But what about circulatory? Do you know and can you recognize the signs of a diabetic, of somebody that has circulatory issues, that maybe have some lymphatic problems? Maybe one leg is grossly swollen than the other one. Do you know what to do in that particular circumstance? See, these are some of the areas where, it is definitely a gray zone. That person isn't really aware that there might be anything going on. So we as a technician looking at their feet want to be able to make those recommendations. How about the diabetic? If you look at the bottom right-hand side of the screen, you're going to see that this is a diabetic. Do we know how to pedicure this diabetic? Do we know the precautions to take? Do we know how long to soak their feet? Do we know the temperature of water? Do we know all the safety precautions that we need to put into play with this particular client? Do we even know how to massage this client? Do we know what kind of products to recommend to this client? So that's where, that education comes into play, knowing and understanding when you see a foot like that, what you can do. Maybe, we can't see the bottom of that foot, so just throwing it out there, maybe he's got an ulceration on the bottom of the foot. We definitely know what to do in that particular case, but maybe he doesn't. Also, nail issues. Look at that involuted nail. Is it involuted? Is it ingrown? Do we know how to cut that nail? Should we be touching that nail? So again, these are some of the things that are falling into that gray area that we want to be proactive about. We want to be able to make the right recommendations to our clients and not either turn them away or do something that's incorrect. So that's our gray zone. So now what? What are we going to do? Where are we going to go from here? How can we increase our profits? How can we increase our revenue stream? How can we elevate our services? How can we take our services to the next level? Win that client over. Be able to feel more comfortable pedicuring a diabetic. And how can you differentiate your pedicure? How can you make that pedicure different than everybody else out there? What can you do with that pedicure service? Because we know there's a lot of competition that's out there. So how do we get that competitive advantage? It's how we differentiate ourselves. So that's what we want to look at now. Where do we go from here? We want to be able to earn more. Well, we need to learn and implement, we call it a European style pedicure or a wellness pedicure or a medi-pedi. But you can't just decide today I'm doing a medi-pedi or a wellness pedicure. You need to understand the implications that go along with that. You need to understand foot care, and that's taking those pedicures to the next level. You want to learn additional specialty services that you can add on to what you're already doing. Raise the average price of your service, implement maybe another service, and add a few a la cartes to it. Mix it up. Keep it special. Of course, yeah, we want to increase our pedicure services. We want to increase our revenue, but we also want to keep our costs down. We want to keep our costs as low as we possibly can without cutting corners. And I say that because you do not want to cut corners. You can't cut corners today. We know that you can't cut corners. But you want to, have some little cost-saving techniques. And I think one of the biggest things is education and teaching our clients what to look for when they go for a pedicure, beyond being told they should take their own implements in, because that doesn't necessarily mean those implements are any safer than what the technician has. And of course, learn some new professional skills. Create a little bit of a network and a bonding with other people that are as passionate about feet and the foot care industry as you are. So this leads me into the NASP Advanced Education. And I know that there is a lot of you on that have taken some NASP programs, but I know that I also have some new people as well. So just, for those of you who are very familiar, just bear with me here a couple of minutes. But NASP has developed educational programs that go beyond that advanced pedicure. It offers advanced certifications for pedicures. And NASP prides itself on leading edge technology, taking that education to the next level. In our course curriculum, it changes. Every year we have changes because we're learning new things. We're seeing new things. And so we incorporate this into our pedicure classes, right to the point where we can't even get it all in the 4 days. So we've had to add in other classes, other modalities, other levels to get all this education in. Because this is where, we pride ourselves. And it's a combination. We also pride ourselves on not just theory, but hands-on practical, working with our students to give them that hands-on, because to us, again, that's something that's really important as well. Sure, we can learn lots of new things online, but sometimes we need to have somebody there to show us how. We're visual. We're touchy-feely people. That's why we're so good at what we do. That's why we love this industry. So the certifications that NASP offers, we have the Certified Master Pedicurist, we have the Certified Podologist, and we have the Bachelor of Science in Podology, and that's the residency program. And I'm going to talk about each one of these different designations because these are designations, and when you've completed the level that allows you to apply for this designation, you can use these letters behind your name, the CMP, the CPOD, the BSc pod on that. So in our education, you'll see that we do have, our very first program, which is the Certified Master Pedicurist. This one here is, this one here gives you the knowledge that you need to take your pedicures to the next level. And I'm going to get into each one of these in just a second. We also have our infection control. Infection control, we have it two ways. We do have in classroom, it's in one day. We also have online, which we split up into 2 3-hour segments, and we have those, 4 or 5 times a year. This one here, infection control, as far as I'm concerned, anybody that works in the beauty industry should take it in the infection control. Whether you're a pedicurist or not, you should have a strong understanding of this. Then we have our comprehensive foot and leg evaluation. We have our advanced information on skin and nail disorders and lower limb. We have our residency, and we have our Pedicure Plus program, which is where our continuing education comes into play. So in our Level 1 program, our Certified Master Pedicure, we get into the biomechanic and gait, just an introduction, how we walk, how gait can, affect the pedicurist. We talk about structural deformities. We get into diseases and disorders of the skin and the nail, learning how to recognize and recommend. We understand the skin of the feet. We get very in-depth into the skin of the feet because, as I mentioned earlier, it's very different. We also talk about specialty services. We get into diabetic foot care, geriatric foot care, toenail correction, PAT. We give practical experience as well. We do 2 days of theory, and we do 2 days of hands-on practical. And this, upon completion of this and writing your exam, and after completing this, you're able to apply for your Certified Master Pedicurist designation. So this is the first, this is your first step. Then it's getting into that infection control, and we talked a little bit earlier about what's going on in the industry, and people say you need an autoclave, other people say bring your own tools and implements, et cetera, et cetera. This is a real tough one because the rules and regulations change area to area, municipality to municipality, state to state, province to province, et cetera. So it's very, very difficult to understand what we're supposed to do when one inspector says this and another inspector says that. So, NASP goes beyond that. NASP goes beyond and teaches above that. So if you follow those protocols, you're complying with your state rules and regulations. So we help you to understand what you need to do. And part of that is understanding microbiology, Spalding classifications, knowing the different levels. If an implement comes in contact with bodily fluid, what do you need to do? If it comes in contact with non-intact skin, what do you do? If it comes in contact with intact skin, what do you do? What are the levels? So we get into that. We also talk about personal protection equipment. Gloves. Gloves is the big thing. Got to wear gloves. Okay. Are your gloves really protecting you? Are they a food grade glove or are they a medical grade glove? Do they fit you properly? You need to know the ins and the outs of everything. If you have to wear gloves, you need to understand why and the proper glove to wear and the differences. And we get into that. And disinfection chemistry. There's so many different things out there. So we need to understand so that we can make a choice about what we want to do. And of course, we also get into the protocols as well of what you need to do on all different areas. And we actually, even as part of the program, you need to write your own protocols. That is part of the program. So it helps to give you an understanding. And when our educators go through that protocol, if they see that there's something maybe a little bit missing or something that you could change a little bit, they'll let you know. They'll help you out with that. Because that's one area that you just can't compromise on. We have our comprehensive foot and leg evaluation. And this we get a little bit more into the anatomy, and we get a lot more into the biomechanic and the gait and how we walk. We talk about systemic diseases. It's interesting because we evaluate gait. So, you put on a treadmill and we watch how you walk. The educator and fellow students watch, and you can make evaluations, because wouldn't that be great if your client comes in and they've got this pain in their knee and their hip, and they're having foot problems, and you're able to make recommendations on proper footwear, whether they need orthotics or toe props, supports, things along these lines. Because again, our clients trust us. They know us. So if we're able to help them out and take that to the next level, this is something that's so important. And another thing that I really like about this particular level is learning about proper footwear and how to make those recommendations. And no, I'm not saying go and throw out your heels, because we all need a pair of date shoes, or what I call my desk shoes. I only wear them when I'm sitting at my desk. But what's proper for when we're doing physical activities or when we're standing on our feet all the time? Things like that. So that's what I really like about this particular level. And our instructor for this level is a pedorthist. She's absolutely fantastic. She makes this class so much fun. So it's not boring, even though there is a lot of anatomy in it. It is an excellent and it's a very exciting class. And after completing level 1, 2, and 3, the Certified Master Pedicure, the Infection Control, and the Comprehensive Foot and Leg, you can apply for the designation of Certified Podologist, and this will give you your CPOD-I. So that's where that particular designation comes into play. Now, our last level, just before we do the residency program, is the Advanced Skin and Nail Pathology. And I'm really excited about this particular class because we just recently expanded it from 2 days to 3 days. We had a lot of students that were asking for more hands-on practical in our level 3 and our level 4. So we moved a little bit of material out of level 3, giving more time for hands-on practical, and we added a day to level 4, giving another full day. So what we can do is we get a little bit more into the lymphatic disorders, things along those lines. Learning how to do the sensitivity testing and the pulses, and how to do the bandaging, the compression bandaging, things like that. This is a very exciting class. I happened to sit in on it in the fall, and I was very, very thrilled with it. It's an excellent course to take, and it is a little bit more intense. It is a little bit more towards the medical side without teaching you to diagnose, but it is preparing you for that residency program, because that's what comes next. We have the residency practicum, and this is where we do our clinical practicum in the island of St. Kitts. We do the presentation of our case studies, lectures, and of course our graduation. As you can see, we've got a whole bunch of happy graduates throwing their hats up in the air. And it's an excellent experience. It's an excellent way to elevate you in your profession, take you to the highest level that you can achieve as a pedicurist, that Bachelor of Science in Podology. And that's what we're trying to do with NASP. We want to raise the bar. We want to take the pedicure industry to the next level. And this is why we have added in and taken the classes right to that top level, right to the top level. And I'm really excited because 2016 is our next St. Kitts year, and that's going to be our 10-year anniversary of going to St. Kitts, so it promises to be fantastic. I know some of you are waiting very, very patiently for information on that, and I promise it will be out to you in the next week or so. We're just working on dates. We're working with the travel agent, etc., just to get you a little bit of information. So that will be coming very, very soon. And this was one statistic that I found very, very interesting. Technicians that attend 2 educational events in a year make take more than 2 educational events in a year, make 15% more revenue. Technicians that attend more than 3 educational events a year make 31% more revenue. So this is something that's absolutely fantastic. Education is key to moving your businesses forward. You don't want to ever stop learning. And I have to say, you are never too old to take classes, to get more education. I met the most wonderful students last year that I was quite surprised by their age, and I was very impressed with the fact that they still had so much passion for their industry that they wanted to take advanced education and take more education and constantly, improve their pedicure. So I was absolutely thrilled to see that. So, make sure that the education doesn't end. It should never end. It needs to come forward. And now, NASP education does not end at the Bachelor of Science. There's more. We have the Art of Touch. The Art of Touch is 2 days on massage modalities. And we get into reflexology, but it's way more than reflexology. We get into some of the energy modalities. We get into the Dr. Locke system of stretches. We get into some specific protocols, how to do a diabetic massage, how to do pregnant women, etc. Does anybody know what that little implement is down, or that little tool is down in the right-hand corner? When we teach you what that is, and we teach you how to use that in the massage class, and if you've ever had a massage with one of those, it's called a Kanza wand. If you've ever had a massage with one of those, it is truly amazing. Now, we also know that we have clients coming in we can't do massage on. So what do? If we can't do a massage on the client, what do? Well, there's energy modalities that we can do. There's Reiki. There's Ayurveda. There's touch. There's so many more things that we can do than just that basic massage. So this particular class will show you how to incorporate these in or use them as a la carte services. When we use the Kanza one, this is a standalone. This is, do the pedicure, but you can also do this as an a la carte, as an add-on to your pedicure. I would never recommend just adding it into your regular pedicure. So that is our Art of Touch. Look for the dates for the Art of Touch on our website, the dates for all of our classes, and I'm going to give you the website at the end because I can't remember all the dates off the top of my head, but all of the dates are listed on our website. We have the Art of Touch coming up in in Toronto, in Western Canada, and I know this isn't on the website yet because I'm just waiting to hear back, but I am trying to get one on the go in the United States in Florida. So bear with me there because I know that, please US, I'm not forgetting about you guys. So this is all coming together, but go to our site. The next one that I'm really thrilled about is the business of pedicures. We learn how to do great pedicures and how to recognize and recommend and, how to work with our clients and, just take our pedicures to the next level. But what about the business of the pedicures? What about running the business? How often do we spend time doing that? And I know that, being a past business owner, the business was running me. I wasn't running my business. And so what I thought is, how can we take our pedicures beyond doing that wonderful CMP service and getting their Bachelor of Science, but it's also in the business, learning how to look at the finances and read the finances. If you're operating your own business, do you know what an income statement is? These are some of the things that we need to be able to look at. What about budgets? Do you do budgets? Do you follow budgets? Do you understand what your return on investment is? So what this class does is it breaks it down into bite-sized pieces so that we can help increase our business knowledge and we can help increase our business. We get into marketing. Social media today, client retention, retail. These are all things that are very important. But we also get into leadership because maybe some of you have staff or maybe some of you are managing. So this is a leadership versus managing. And then, of course, as always, motivation. Because we all of us, every now and again, need that little bit of an oomph, that little bit of a push. And that's, exactly what this is meant to do as well. Plus, it also enables you to network with other like-minded pedicurists so that you have other people to bounce ideas off of as well. So I'm really excited about this one. And again, this one will be offered, in the U.S. and in both sides of the country. I believe right now there are 2 dates, one on each side of Canada. But again, bear with me. We are getting more and more dates on there, and we are looking at more and more fall dates. And there's more. We haven't stopped there. We have refresher classes. We're going to be, and I've had a lot of people requesting refresher classes. So I'm going to be offering a refresher class. It's going to be a 2-day update. And it's just going to update. You need to be a CMP to take this. Okay? You can't just, have pedicure knowledge. that to take the refresher class, you need to have already have taken the CMP class. Now, that said, I would offer to anybody who has taken any of our NASP classes, you can retake that class for 50% off. So you can do the refresher update, or if there's a level, a CMP class in your area for 50% off, you can retake the whole class. Absolutely not a problem. The choice, the decision is up to you. We also have private classes, and we're doing more and more private classes. This is where we go into the salon and we educate the whole team on how to do CMP pedicures. So this is something that we do. We do it in the salon, and then, of course, I've got a couple of areas where they may have a little bit of a smaller salon, so they've banded together with a couple of other salons so that they've got a group of people coming in and bringing us down to do these classes. We're more than open to do that. So we do have the private classes, and we've actually started listing the private classes on the website because sometimes, not always, but sometimes the salon will open it up to one or two people that might be in that area or that might be coming in from another area, out of the area. But, you know, don't hesitate to ask the question. We have a medical pedicure class. Now, this is for technicians that are working with MDs and podiatrists. This is a specific 5-day class that enables you to work very, very closely with the podiatrist and the doctor. So this, again, is something that we have taken to the next level. And, of course, we have consultation services on request. So any of these classes here, the refresher classes, you will find a couple of those on our website, but all the rest of them, you need to contact us for more information on that. Now, I would ask that when you are contacting us, and again, I'll put that page up where our contact information is, but please let us know in detail the location that you're looking at, sort of an idea of dates that you're looking at and what exactly you are looking for. That just facilitates it for us so that we have a better understanding and we're better able to meet your needs. So these are the exciting things that are happening with NASP and where NASP is going to be going in 2015. So this is all great, and we love the education. But now I want to hear about a return on investment, because, you know, I love education. I mean, I always take education whenever I possibly can. I'm always finding something to do. But education is wonderful, but we do need to see a return on our investment. And so this is where, you know, how do we see that return on investment? Well, you've got the legal designation and the diplomas. Frame them, get them up there, shout it out to the world. You guys worked hard to get these designations, so let it be known. The other thing is we have a CMP finder, and I know we call it a CMP finder on the NASP website, but we list anybody that's a CPOD, anybody that's got their Bachelor of Science. They will all be listed. Anybody that is doing BS braces, let us know so that we can get you on that finder. Now, that said, we do need permission with the privacy laws that are in play now. We need permission. We just can't add anybody and everybody that has taken a class over the past however many years, past 10 years. We can't just put them on that website. We did do some blasts, we did do some mailings, we did when we launched all of this, but we know that people got missed. So if you got missed, please email us. We will get you on that finder. We just need your permission. So use that to your benefit. I got people calling NASP every single day. I had 2 today. I had one person looking for a CMP in downtown Toronto. I had another one looking for somebody that wants to go out to a hospital. Wants somebody to go out to a hospital. I look on the CMP finder and I'm like, ooh. So get your names on there. This works to your advantage. The other thing is, you know, be more informed than your competitors and know more than your clients. Your client says to you, or you got a new client walking in and she says, how come you charge $75 for a pedicure and I can get one down the road for $55? Know why. Tell her why. Let her know why your pedicure is more. And you know what? Give her a pedicure and she will know why. Now, of course, again, earn more. Get your prices where it's competitive. And I know sometimes for us, it's difficult to raise our prices. I know our clients, sometimes they become almost like our friends. But the thing is we also need to make a living. We also need to get a cost of living raise. So you want to have and use that full potential that you can use. And I know there's places out there. There's lots of places out there that are charging $100 and $125 and $130 for pedicures, and they're booked all the time. It is what they offer. They give value to the client, and that client keeps coming back. So that advanced education through NASP is going to help you take that pedicure to the next level. And we do have a bit of a business model, and I think you guys have all seen this business model. Every single pedicure chair should be earning a profit of $71,000 a year. And this is based on 6 pedicures a day, $75 for a pedicure. Okay, this is what this is based on. So the numbers are tried and they're true. But you just do a little bit of simple math yourself. How many pedicures do you want to do in a week? You want to do 20 pedicures in a week? And you want to charge 75 pedicures. You know that if that's the case, you're going to be making $1,500. So how many weeks do you want to work in a year? 48 weeks in a year? That's $72,000 right there. Okay? So that's not even working at your full potential that you could be working. That's not even with some of the a la cartes and the add-ons. So, those are some of the things that you want to look at. And this is where I talk about business and understanding the numbers. Because I think sometimes we forget the numbers. And if we start paying a little bit more attention to the numbers, this can help us out. This can help us achieve and get to that next level. So, of course, we want to earn more by being professional, striving for excellence, and, of course, a la carte services, even beyond. So be that professional. Look at those 2 lovely ladies on this screen. Look at the professionalism there. You be professional by doing consultations in your pedicure service. Be professional by using a good quality pedicure product, good quality pedicure tools and implements. Have a nice proper station set up. Pay attention to the detail that is around you. That's what I mean by being professional. Look the part, be the part. Implement that part in there, and it makes a huge, huge difference. And I know that we're running out of time here, but I have to tell you this one little story. I was back in the classroom a lot this last fall. I met some beautiful people. I met wonderful people. I always meet the greatest people. I have the greatest students in my classes. And, I had some that were like, wow, you charge that much for a pedicure. Gee, I'm concerned. I would like to charge that much, but I'm concerned. And, fortunately, through that wonderful little thing called Facebook, I've watched these students grow and take their pedicures. And I'll be honest, I am thrilled. I'm not always on Facebook. Bless Amber for taking care of all of that for me. But every now and again, I do go on Facebook and I take a look. And the growth that I see in the NASP alumni and people that have taken the different classes, it makes me very, very proud to know that I've been a part of that, and I've enabled that person to go to that next level and help them, give them that helping hand to go to that next level. Because we can all do it, and it just takes that first step. Specialty treatments, BS brace. For those of you that have taken a level 1, the CMP, you learned about it in level 1. Maybe it wasn't for you at the time. Maybe you were more into something else. Don't discard this. $50 per brace application. And I know there's some of you out there that are, they talk about this on Facebook. They're getting phenomenal results. So relearn it. Give me a call. I'm happy to help you walk through. There's a DVD that comes in the kit. But, we're here to help you. So don't forget about this, because you can get excellent results. And because of footwear today, we're seeing more and more people with that involuted great toe that gives them grief. We also have the PAC, the photodynamic antimicrobial therapy for those thickened, yellow, discolored, lifted toenails. This is another specialty treatment that can add dollars to what you're doing. And I'm excited because I know a few people personally that have experienced exponential growth in their business by adding this in. Because this is something that does truly work. And it's an LED light, so we as technicians can do this. And don't forget the specialty treatments, massage modalities, additional services, plus it increases product sales. You can see that little tool we saw at the Art of Touch. We're using it for massage. When we do that type of a massage, we do a scrub first. We use the massage therapy lotion with that. So this all works together, and it's going to help increase your product sales as well as add-ons to your services. So create that point of difference. And just to finalize that point of difference to give long-term results, but also, the ability to use tools and implements that facilitate what we're doing, to perform that service, because we know NASP is dedicated to providing the highest quality products, renowned for precision, performance, longevity, reliability, and of course, uncompromising quality. Our tools are custom manufactured. We work with the tools. We work with our developer so that we can tweak them, so that they can be the best they can be. They are podiatry grade, but they're at pedicure prices, so we can afford them. They're made with world-renowned Salon stainless steel, a good quality stainless steel, not just plated, with nickel interior, and very nice high quality. Bits. The NASP bits are manufactured in Germany, and they're based on European medical device standards. So we know that they have to be a very high standard. If you know anything about Germans are known for precision. So they are very high quality. They're stainless steel in the shanks. They're diamond carbide and chromium for the heads. And these bits can be very, very time-saving for you, plus intricate. Electric file, the vacuum suction that has the computerized board. Sucks in the dust. You don't have to breathe it in. You're not risking your health. You don't have to wear a mask. And of course, yes, we know that might be a little up on the wish list. We also have the small rechargeable portable e-file as well. So there's different options that are out there. And again, these are some of the things that we teach in our classes. How to facilitate your job as a pedicurist, but how to do a safe pedicure, how to sit properly. If you noticed when on the slide for professionalism, both Catherine and I were sitting to the side. We don't want to torque our body. We don't want to constantly have to be lifting a foot up in the air. You need to protect your bodies. You need to protect yourself as well as protecting your client. So there's time and health-saving techniques. I mean, we can use them for, reducing very thick graphotic nails, hyperkeratosis, callus, clean the nail groove area. I mean, I want to show you these before and after pictures using, the corn bit. How about callus reduction? Wow. Yeah, exactly. Wow. That would take a lot of hand filing to get those kind of results. But a combination of using a good quality product and good quality tools and implements and having the know-how. And as you can see from that bottom picture, that technician knows when to stop, when not to go too far. You can't take it all off. So that's, again, the point of important education. Toenail reduction. You could not, using a hand file, reduce that toenail. And that poor client, they were just always so embarrassed. They'd cover that toenail up. Now, with that toenail being ground down, it's much more aesthetically pleasing. It's actually starting to grow out and look a lot nicer. And this particular person's like, wow, I can wear sandals again. I feel good wearing sandals again. So, you can have a profound effect on how you make your clients feel. So that return on, education, Educate, differentiate, elevate. That's your return on investment on that. So, know what your vision is. What do you want to be a part of? Know who you want to be. You want to be that pedicurist. You want to do pedicures. You want to take your pedicures to the next level. What's important? Doing a good, clean, quality pedicure. How am I going to get there? The capabilities. Always advance yourself. Always take education. If you don't understand something, if you don't know, ask the question. That's what you're going to do differently. Take the education, ask the question, take your pedicures to the next level. Focus on where you want to be, but always never lose sight of that vision. And that's going to change your environment. That's going to take that pedicure to the next level. So if you want to increase your revenue stream, build a loyal clientele, increase your service menu, get trained in advanced pedicures, sign up today. Look at this wonderful, happy group of students that have just completed their CMP program. I think this was down in Florida. So it is exciting, but I think part of that is not just the education, but it's also the network, the being able to work with other people. So contact us. This is all of our contact information here on this particular page. I'm going to leave this page up. I am going to open the floor up for any questions. You will see on the right-hand side of the screen a question box. Just click on that question box, and if you have any questions, type them in there. Now, if you are inquiring about the dates of classes, please go to our website, okay? That will have a list of all of our classes. Website, NorthAmericanSchoolOfPodology.com, okay? And I just want to go through some of the questions here. CMP class is a must-have for everyone doing pedicures. Best class ever. Wow. Best class I ever took, changed the way I see my clients' feet, how I talk to them, and my business. Thank you very much for that. But this just tells you the importance of that advanced education. And no, I did not bribe or pay this person to say that, but that's how excited we get when we're doing something that we're very, very passionate about. Are there any other questions that are out there? If not, that's okay. Or if you have questions that come up after the webinar, you can always email nasp@kvggroup.com, and we'll be happy to answer any of your questions. Yes, our classes are not typically done online. We only do the infection control class online because our hands-on is a big part of what we do in our pedicure services. So that's where we only do a certain amount that is online, and that just happens to be the infection control because that class is theory. All the rest of our classes have a large component of hands-on. So I have to apologize. I know that it's difficult for some people to travel, but you're from St. Lucia, you grab a group of people together. I'd love to go to St. Lucia to teach a class, and I'm sure a lot of my educators would be absolutely wonderful as well to go down there. So, we're happy to go down and do a private class. All righty. What's our next question? So it says the scope of practice. Where does that take you? Well, the scope of practice, it takes you to the next level. You're no longer doing just that. And please, by all means, don't get me wrong on this. I'm not belittling any type of pedicure, but it takes you beyond that basic pedicure. It gives you the expertise to understand the skin, to understand precautions to be taken, to understand, how to do the specialty services. If somebody does have an involuted toenail, it helps you to understand and shows you how to cut that nail properly so that you're not leaving spiculas behind. You don't risk giving anybody an ingrown toenail. So this is the scope of practice. It does not turn you into a medical professional. That's not what we're trying to do here. We're trying to teach you can work with medical professionals, but it doesn't turn you into a medical professional. Art of Touch in Chicago. Well, I would love to go to Chicago. I like Chicago. It's a wonderful city. And, hopefully it will be very soon. Right now, I don't have one. I'm actually looking at the first one being in Florida. But, if there's a lot of interest, please send me an email and tell me the location, because we'll compile them all together, and the areas that have the most interest, we will definitely look at putting a class together. Absolutely. Hands-on, that's awesome. I have to agree with you. I am that type of a person as well. I have taken a lot of online classes, and I've also taken in-classroom classes, and online definitely has its advantages when it comes to theory, but I'm more of that touchy-feely person. I have to agree with you. I love that hands-on. Thank you for that comment. Does this open up any doors, does this open up any liabilities because we're not doctors? You're not doing anything medical. You're not removing an ingrown toenail that's infected or anything along those lines. So that's where we want to teach you to, recognize and recommend and know when to refer. Because there are things that are out of our modality, and we don't want to be doing those. So when we talk about reducing calluses, we're simply reducing skin. That's the same with, working with corns. We're reducing corns. So that's the difference there. We don't remove, we don't cut out, we don't do surgeries or anything along those lines. So liabilities, no, it doesn't open up any more liabilities there. Just make sure that you're not, crossing any of the lines. How many people do we need for a private class? It depends on the location of the class. If I have an educator right there, the expenses aren't quite as great, so we can do that with a little less. But ideally, when it comes to the CMP program, we need to have a minimum of 6 people. And the reason I say that is because it also depends on models, right? You've got 6 people, you're going to have more models coming in, you're going to learn more. So that's where, for that private class, you want to have at least 6. Because that's gonna help you learn. The more models you see, the better it is. Now, when it comes to things like the business class, the Art of Touch, and the refresher curriculum, we need to have a minimum of 10 people to hold that class. That's only a 2-day class. Those ones are a little bit shorter, so that's where having more people, and that's where we're going to look at a more generic location, places like Chicago, Florida, places that are a little bit easier to fly into, as long as, we stay out of Florida in peak season. The hotels are actually quite reasonable, things like that. Okay, so that gives you the answer there. And of course, as always, contact our office. We're more than willing to work with that. Are we going to be at the Vancouver ESI show? Absolutely. Amber and I will both be there. So yes, by all means, come by the booth, see what we have new, see the electric file. We will have that there along with all the other tools, implements, bits, everything like that. The braces will be doing demonstrations and, a little sneak preview into some of the classes and everything. So yes, we will be in Vancouver. Okay, excellent. I've just got people that are very excited about the new classes, also about the classes coming up. We've got a level 4 coming up in Chicago in May. Really thrilled about that. We've got a level 3 coming up in Chicago in March. very excited about that. You know, so we are, you know, spreading out with our classes more and more. So thank you for that. We are definitely, you know, listening to our clients. I love it. Guess what? I just have confirmation that there will be an Art of Touch in Florida in April. Thank you so much for letting me know that. You guys are absolutely, you know, you got to sign up for that. You are going to love this course. I love this course. I love teaching this course, and I absolutely love what you can gain and how you can add that to your pedicure. So that's excellent as well. I have somebody asking, Art of Touch, do I have to take any previous classes? No, you do not. The Art of Touch is not something that you need to take the CMP for. If you want to take level 3 and 4 and the BSc, you absolutely have to take the CMP, but the Art of Touch and Infection Control, they're two classes that are kind of standalone, so you don't have to take that CMP to take it. So yeah, absolutely. If you want to get a little bit of a taste of what NASP has to offer, you're more than welcome to take this class. Excellent. I believe that's all the questions that I have for now, but like I say, if I have missed any, by all means, please don't hesitate to blast us off an email, and Amber and I will do our best to get them answered and get classes set up and be moving forward with NASP in 2015. Thank you very much, everybody, for your attendance this evening, and here is to a very prosperous, happy, and abundant 2015. Good night, everyone.